pharmacist is no one is going to work as a dispenser. So it was clear cut. It was very clear and clearly written that other than a pharmacist, no one is going to be a pharmacist or no one is going to do the work of a pharmacist. But in this bill, it is just the definitions are not clear cut. We can interpret in our own way. Sometimes I feel so while going through it. The thing is, of course, we welcome the national NPC bill. It is definitely for, as everyone noted, for according to the global standards, we should raise it. So we welcome it, but there are some flaws. And according to my observation, in section 2, definitions, pharmacy practice is not defined. So in the definition, pharmacy practice, practice pharmacy includes dispensing of prescriptions of a registered medical practitioner shall be inserted. But I don't know whether it will be practical now because as some of the delegates pointed out, it is going to be implemented very soon. And I don't know what is the scope for this now. Anyway, then Pharmacy Ethics and Registration Committee shall have representation from practicing pharmacists. There is no scope for practicing pharmacists now in this bill. So that is one flaw. Then again, in chapter 4, section 23.3, 2A, 2 persons of eminence from the pharmacy profession having diploma or degree in pharmacy and 10 years of experience in either government, private sector to be nominated by state government may be substituted. We should definitely have representation from dispensing practical pharmacy practicing side. A notable gap in the bill regarding the role of pharmacists in public health leaves no representation for qualified community pharmacy professionals who work hand in hand with the public in drug procurement and distribution. Nomination criteria for key positions do not adequately recognize the importance of pharmacists working in public health mainstream. Pharmacy professional means a pharmacist whose name figures in the national register, right? In pharmacy, professional names are needed so that the qualification can be distinguished. But here in NPC bill, the qualification is not distinguished. Everyone not pharmacy professionals. In chapter 319.4.6, introduction of any new pharmacy course shall be replaced by introduction of any new, the specific course should be noted. Either D form or B form or M form, whatsoever it is. But only introduction of any new pharmacy course may lead to fake pharmacy courses. In chapter 4, state pharmacy chapter, a pharmacy leader is noted, but pharmacy leader is not defined. So there is lack of, even though some terms and words are used, the actual definitions or the terms are not defined. It may cause speculations or over speculations or interpretations according to one's own way. That is the concern. Then in chapter 4.3, part 3, subpart 3, form D, M form, B form, D form or other qualification. There, the other qualification is to be omitted or deleted. Because we can't include other qualification. The qualification must be precise for a pharmacy profession. We were talking that pharmacy is a technical. We are technical professionals, and how can a technical professionals be diluted with just stating some other qualification? Just putting inverted comma, other qualification doesn't mean that it should be precise for pharmacy professionals, isn't it? So that is to be noted. And the others, most of the delegates have already noted about it, so I'm not going through once again. And actually I've got some other points also, but it is not fair to just tell everything about it in this short session. So I'm just putting an end for that one. The next is pharmacy courses. Okay, we have got many courses. Now, many of our delegates point out. Form D. Pharmacy courses like Form D is a doctoral degree designed for a wide range of career opportunities in healthcare system. And we know during the COVID outbreak, the vaccination, I think, for the whole world, the vaccine was supplied from India. India was the largest exporter of the vaccines, and even United States of America asked India for the tablets, isn't it? During the time of COVID, they relied on India, but we could not actually the importance or the role of pharmacists in research industry, we could not highlight it to the global standards or at least in India. We were working behind the screen. We were working as researchers. We found out the vaccines. We manufactured the vaccines. We exported the vaccines to whole of the world countries. We get raw materials from China and we manufacture most of the drugs in India and we export it. And actually it brought us lots and lots of revenue income to India. But we did not take the opportunity to highlight this or enlighten this to our higher authorities. All what they saw is the doctors and nurses who were just working out in the common. But for each and everything, we were working behind the screens. Our hands were working all the time behind the screens, but no one recognized or appreciated. Not appreciation, they just did not recognize our this invisible hands, isn't it? That